joining here. Let me see here. Okay, perfect. All right. Hi, everyone. Thanks for joining. We're just going to wait a couple of minutes, let everybody join in the room. I am Alex Ruiz. I am the Director of Content Community at Paloma Health. So we're just going to go ahead and get started probably in the next couple of minutes. So hang tight while we get situated, and we'll get started soon.
Thanks, Alex. Today is going to be a different one for me because I'm usually the co-host with Alex. And today I get to be one of the guests along with the esteemed Sean Zager, who is one of our top Paloma docs. And Sean, what is your background? You're a holistic MD, or are you a DO?
I am a holistically minded MD.
Okay.
Yes.
All right. And Sean is always one of our folks at Paloma that we go to when we want to talk about thinking outside the box and really cutting edge thyroid treatment. So I am so excited because I've done a couple of events along the way with Sean, and this is the first time I get to be in the guest seat with him. So this is going to be a lot of fun. And I hope that we're going to be able to really share some great information for everyone about natural desiccated thyroid and the pros and cons and whether it's a good fit for you. Because as we all know, one size does not fit all when it comes to thyroid treatment. And that's one of our Paloma mottos. And hopefully we'll be able to help you make some better decisions going forward into the new year as to what the best fit is going to be for you as far as your thyroid treatment.
Absolutely. Mary, I'm really excited to kind of jump into this. And I really, one of the reasons why I love holistic care and holistic thyroid care is just exactly what you're saying, that it really is a type of care that needs to be individualized to every person. You know, there's protocols out there, there's lots of options out there, both in terms of how you look at things diagnostically and treatment wise, but it's really nice to be able to individualize it for every patient. And I think natural desiccated thyroid is a perfect example of that in that conversation, because it's some of the, you know, I was thinking in my own head, thinking of pros and cons. I'm not, and we're going to get into the nitty gritty of all this, but in many cases, the pros may be cons for another person and vice versa. So I'm excited to try to parse that out a little bit and just give people information so that the care can be individualized for them with their provider.
Absolutely. Absolutely. Well, I think nowhere do we see a need for some individualization more in some ways than thyroid, because it's not cookie cutter. Some of the conventional world wants to treat it as a cookie cutter test and cookie cutter solutions. But I think everyone that's affiliated with Paloma has discovered, and many of the patients that'll be joining us today also know, and they've learned the hard way, that cookie cutter solutions aren't always going to be the way to go when it comes to thyroid, because there's a number of factors that go into becoming a thyroid patient. And there's a number of things that need to be addressed to get you to a place of balance and better health.
Yeah, absolutely. Absolutely. Yeah. I look forward to kind of hopping into it, as I'm sure we'll do here in a few minutes.
Yes.
So, yes.
Alrighty, on that note, yeah, let's go ahead and get started. I see a few people rolling in here, so I want to make sure that we're mindful of everybody's time and we're just, you know, getting the ball rolling. So you guys kind of went ahead and introduced yourself, but again, I just wanted to go ahead and introduce the team. My name is Alex. I am the Director of Content and Community here at Paloma Health, and I also have Hashimoto's. So hypothyroidism and Hashimoto's advocacy and care, just thyroid health in general, is really near and dear to my heart. So I'm just super excited to be a part of the team. We have Dr. Sean Zager and Mary Showman, as well as our guest speakers. So why don't you guys go ahead? I know you introduced yourselves a little bit, but just give us a little bit of backstory about kind of your role in the thyroid space, why thyroid health in general, and just, what brings you here, and kind of your overall philosophies within the care. So Mary, why don't you go ahead and get started with us?
Sure. Well, I'm Mary Showman, and I am an advisor to Paloma. But many of you probably know me because I've been around for about 25 years as a patient advocate. And I've run several websites, including for what used to be the mining company and about.com, and is now verywellhealth.com. And I am a writer. I've written a number of books, health coach, but really my biggest passion for the last 25 years has been helping thyroid patients live well and feel well, because I am one of you. I was diagnosed 25 years ago and got the standard, oh, here, take a pill, you'll be fine, come back in 6 months and no problem. And discovered that it wasn't that way for everyone. And I certainly was not one of the people that took the pill and came back and felt great a couple of weeks later. So since that time, I've been on a mission to find better solutions and more ways to integrate everything into my life to feel well. So it's not just about thyroid meds. It's about nutrition. It's about lifestyle. It's about mindset, attitude, all of the different factors that come into play. Which is why I am so excited to be here with Sean Zager, who is an integrative physician, who is one of the guys that can tell us how to integrate all these things in. So Sean, I'm going to turn it over to you for your introduction.
Thanks, Mary. So my name's Sean Zager. I'm an integrative family physician. I am talking to everybody here from Ann Arbor, Michigan, which is where I'm from and where I went to school many years ago. I just really, I love being an MD. I love working with patients from this vantage point and offering patients a alternative to the more protocol driven medicine that we see in many cases, and certainly in thyroid care. I just think that it's not alternative medicine. It's really just good medicine to help people understand their options inside the box and outside the box, what might work and obviously might help them without causing harm, and how those medication options also interrelate with our lifestyle choices, and whether it's nutrition or exercise, stress management, sleep hygiene, these types of things, and even how it might relate to other parts of our healthcare, like nutrient, vitamin, mineral deficiencies, adrenal health, etc. And so thyroid care is something that I love to be a part of it. I love to work with my patients to optimize their thyroid health. It's just really satisfying. It's so nice to help people know their options, what's on the table for them. But again, both in terms of diagnostics and also treatment that many patients don't know, many providers aren't aware of. In some way, it's very nuanced, but it's also in some ways cut and dried, where there's a clear path forward often. It's often stepwise, sometimes 2 steps forward, 1 step back. But we almost always get to this place, the promised land of really optimal thyroid health. And it's really satisfying for patients and for me. And so I really do enjoy it.
So I love what you said about kind of just, it's like a balancing act, and there's so many factors that go into it. I think one of the biggest things, and everyone will realize, is when I was initially diagnosed, I just thought like medication would be the end all be all, but I was still living a very stressful life. I didn't really optimize my diet as well. My lifestyle in general was just go, 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 very stress prone. And, I had no idea about gut health or anything. And although I do think, medication is sometimes necessary for some people, sometimes maybe it may not be as extreme and it makes that big of a difference. But I do feel like there are other factors into it. And with that being said, it's also based on the right medication, because I took this medicine for so long. For me, I didn't do well on Levothyroxine, and I started dabbling into natural desiccated thyroid, which is, we'll talk about the different types later on in the conversation. And I just felt so much better. And I think it's just so important for people to realize that, there's not just one medication type. And, it's really just kind of experimenting and finding what works for you, because like nutritional aspects, right? Some people might have more food sensitivities than others. So it's not necessary for you to completely cut out like nuts or maybe dairy or nightshades, for example. But for some people, all of those might be an extreme trigger. So everybody is so different. Everyone is so bio-individual. So with that being said, I mean, I think a lot of people just in general are just aware of that they have to take a medication. But can you really give us, Dr. Zager, like a brief introduction of what thyroid hormone replacement therapy is and the hormones this medication can support, especially for those that are just being diagnosed? Like, how does it truly work in the body and affect you? And like, what's the goal, I guess you can say, when being on this medication?
Absolutely. Yeah. So, I mean, very simply, well, so patients who are hypothyroid have, for one reason or another, and there can be various reasons, a thyroid gland that doesn't produce thyroid hormone to the extent that it should. Our thyroid does many things. It's essentially the motor of the body. It does so much to maintain our metabolism, and really affects every organ system of the entire body, maintaining balance in those systems and giving us energy also largely. So when patients have low thyroid, when their thyroid is not working the way that it should, that people often experience fatigue, a host of other symptoms, whether it's sleep disturbance or weight gain or hair loss or constipation, dry skin. And by taking a thyroid hormone, and there are various options. We're going to talk today about, I think, one of the main categories, which is the natural desiccated thyroid, which is actually a desiccated or dried porcine or pig thyroid that contains both T3 and T4. And so I'll use that to explain that in our body, the thyroid gland produces both T4 and T3. These are two forms of thyroid hormone, but the active form that really gives us that boost in energy and helps keep our motor running is the T3 component. So our bodies, we depend on our bodies to convert the T4 to T3. Some people's bodies are very good at doing that, and in those people, a T4 medication can be perfect. But some people's bodies aren't as good at doing that, and I specifically, when people have more inflammatory conditions, I find that it really can inhibit that conversion from T4 to T3. So in those patients, you'd want to think more about giving them a medication that includes T3, like natural desiccated thyroid, this porcine thyroid. But whatever medication it is, basically you're going to use either a T4 medication and or a T3 medication, or a combination product like natural desiccated thyroid or a compounded version to replace those thyroid hormones that aren't being produced by the thyroid gland in hypothyroid patients.
Yeah. I kind of, you touched on it lightly, but Mary, can you kind of give us some insights onto, we won't talk about the other three specifically today, but I think it's important for attendees to know that there are 4 different types of thyroid medications. As Dr. Zager said, there's combinations, and then there's maybe T4 only. Can you give us some insight on the 4 different types and like, how do they differ? And,
Sure.
A simple way, I guess, to know which one is right for you. I know that's a complicated, loaded question, but
Sure. Well, as Dr. Zager was explaining, we have 2 key hormones that the thyroid is producing, T4, thyroxine, and T3, triiodothyronine. And the issue here is that the vast majority of thyroid patients are prescribed a synthetic form of the T4 hormone, and that's called levothyroxine. And you might recognize brand names like Synthroid or Levoxyl. Those are in tablet forms. There's a lot of generic, different manufacturers of generic levothyroxine. There's Euthyrox. And then there's a category of levothyroxine that's not tablets. It's liquid, comes in a gel cap or in a straight liquid called Tirosint. So that's one category of the synthetic T4. But as Dr. Zager mentioned, if you're taking a T4 only medication, the assumption is that your body will be able to convert that T4, the storage hormone, into the active T3, which is what we need for that motor to run. There are some patients that don't do as well for a variety of reasons. They're not converting well, they're not absorbing it well on those levothyroxine drugs. And for them, some of them do quite well by adding to their levothyroxine a second hormone, the T3 hormone, in a synthetic form. And the brand name there is Cytomel. And there is also the generic, you can get generic version of it as well, liothyronine. And this drug, this combination of the two synthetics, in some cases can be quite helpful for people, because we have a subset of thyroid patients that don't convert well, or that aren't manufacturing enough T3 itself in the body, so that even if they can convert some, they don't have enough to start with. Then there is this third category, natural desiccated thyroid, which is, again, the dried thyroid gland of pigs. And because it's coming from a natural thyroid, it includes both of the hormones, T4 and T3, but in a slightly different form. They're the natural hormone from the animal, the dried animal thyroid. And some patients do quite well on this. This is a drug that was available for more than 100 years in the United States. And some patients simply find that they do better on it. Even apples to apples, T4, T3 combinations where we're trying to match the exact amount. Some people still do better with natural desiccated versions. Some people still do better with their synthetic versions. And then there's a fourth category called compounded medications. These are still prescription thyroid drugs, but they do require use of a compounding pharmacy, and they're going to be putting together customized amounts or customized combinations that can include synthetic T4, synthetic T3, and natural desiccated thyroid in any particular combination or dosage size. And those are written specially for you by your doctor and filled at a compounding pharmacy. You can't get those filled at a Walgreens or a CVS. So those are the four categories of thyroid drugs. And then, Alex, you asked the ultimate question, which we all hear all the time, which is, what's the best one for me? And I'll say simply, I have an answer. The best thyroid drug for you is the one that safely works best for you. And I'm going to ask Sean if he agrees with that particular assessment, since he's the doctor here.
No, hey, Mary, I appreciate your expertise. You know a lot about this stuff. Obviously, you've written about it for years, decades, I think. And
yeah.
No, of course. I mean, that is the truth. And again, I think this is the beauty of a holistically minded thyroid care, is that there's these options, and there is a medication that's right for each individual, and it's really about working with that individual working with their provider to identify which is the best medication. And there's lots of, it's nuanced. There's lots of variables. Does a person have Hashimoto's or not? Is there an autoimmune component? Sometimes it is a bit of trial and error. Sometimes it is that stepwise process. But it's nice to work with a provider like the providers we have at Paloma to honor each one of these options as an option for each patient, which isn't always the case in a more conventional setting.
Right.
Yeah, we kind of segue into like our next question, but I mean, I have to make the note that, for me personally, when I had tried both Synthroid and Levothyroxine, and I had experienced hair loss, like frequent migraines. That might not be the case for everybody, but I actually experienced worsened symptoms when I was on those medications. And quite frankly, I just wanted to try, in my mind, I didn't have the knowledge back then that I do now, but in my mind, I was like, oh, synthetic, I want to do something more natural. Can we try something else? What are other circumstances, I guess, from just a provider perspective, but also like what you hear patients express and what you see based on their lab work, that they would need to use NDT-based medications for their hypothyroidism? And, are there pros that actually make this a better option than, let's say, compounded versus synthetic?
Sure. And Mary, I want to hear from you too, obviously. Okay, a few things on this. So I mean, first of all, it is true that the natural desiccated thyroid is a more natural product. I mean, right? It comes from another animal. It's not made and produced in the lab like Synthroid or Cytomel. So that can be attractive for people, you know, and just knowing that it's not a synthetic medication. I will say, and there are nuances here, of course, but across the board, at least when you think of like the two main natural desiccated thyroid options out there now, which are Armour and NP Thyroid, as the others are not available anymore. They're pretty clean products, both of them. For example, so NP Thyroid has really no gluten, no lactose, no sucrose, no dyes, no corn. Armour has none of those either. Although I think Armour does have a little bit of corn filler, but none of the others. And while there are on the other side some examples of clean synthetic products, when you look at your more generic levothyroxine, it has gluten fillers, it has lactose, it has sucrose, it has corn, it has dyes in it, things that see in the natural desiccated thyroid option. So while there are clean examples on both sides of the coin, for kind of discussing with your provider, by and large, the NDT, natural desiccated thyroid options are very clean. And I guess too, I'll just round this out by saying my answer now, saying that some patients really do well with that T3 component, right? So while you can do that with synthetic T3, whether it's compounded or in addition to a synthetic T4, it can be nice to have that built into your medication. It's one pill, and so that can be really appropriate for many patients too.
Well, I would just add that it is truly, to a large extent, a trial and error process. And even many of the holistic and integrative doctors that I know oftentimes will start a patient with the synthetics. Oftentimes a synthetic with a combination, maybe a T4 drug like a Synthroid or a Levoxyl with a little bit of T3, so that they can titrate that T3 up and down, because the T3 is such an important element. But there is a subset of patients who seem to really not be able to get into an optimal place on the synthetics. And many of the doctors that I know, and I know many of our Paloma doctors as well, will often say, well, let's see if natural desiccated thyroid might be a better option. Sometimes the patients are the ones that are agitating and saying, let me try the natural desiccated thyroid. I know I certainly was one 20 years ago when I was on Thyrolar, which is now discontinued, but that was a combination T4, T3 synthetic drug. And I was taking that. I was doing okay, but not as great as I wanted to. And finally I said, look, I want to try the natural desiccated thyroid. And that turned out to be the sweet spot for me. But some patients find that when they switch to NDT, they definitely have a better response than even on a synthetic that's a dosage for dosage match. And we don't always know why. I don't know. Maybe Sean has some insights into this too, but I've heard various theories, because the natural desiccated thyroid, in addition to the T4 and T3 hormones, has calcitonin, and it has other cofactors, and T7 and T2, and some of these other thyroid hormones that we don't even know exactly what they all do. But the theory is there's something else in there that some people may be missing, that it's meeting the need so that it ends up working better for them. But again, this was until the 1950s the only thyroid hormone replacement option we had, and people were generally pretty happy with it. It was a very safe drug. It was well tolerated, and it was very effective at resolving what in the past had been a fatal and very long-term demise kind of condition, being hypothyroid. And we had this, half century of people really getting benefits from this medication. And, at this point, I'm still testament to people that are still benefiting from this medication 70 years later. So I'm not complaining. So it really, again, I think is, if something isn't working, try something new. And the key is that you have to know there are options, because some patients out there only think Synthroid is they don't even know there's other options within levothyroxine. They may think there's just Synthroid, but there's other brands, there's combinations, there's the synthetic combos, there's natural desiccated thyroid. So my advice to patients as an advocate is keep searching. And if you're not with a doctor who's willing to present the options to you and help you navigate through those options, then it's time to jump out and work with someone who's willing to guide you to find the right option.
Yeah, I love it. I think that's, advocacy, as we know, in the thyroid space is just so key in finding a provider that, is willing to do the trials and errors with you. But I think also there comes a little bit of patience from the patient perspective. We can't expect to be, our old self, or even just feeling, like $1 million the next day. Like, these things do take time. So it's just important for us to really practice grace and just, hopefully let the medicine do its thing. What are some of the challenges, with NDT? Maybe if you could give some history into the FDA and everything like that. And you said it's been around for 100 years, but there seems to be a lot of challenges that patients face when it comes to wanting to implement this, either from their providers or maybe just accessibility. Can you discuss some of these challenges, and what are ways that I guess we can overcome them?
Well, I think the biggest challenge is that there is a conventional medical bias against NDT, against natural desiccated thyroid, because, as we mentioned, the natural desiccated was the only thyroid hormone replacement for the first half of the 20th century. The levothyroxine, namely Synthroid, was introduced in the late 40s, early 50s, and started to get some traction as drug manufacturers presented it as the modern solution, the synthetic, it's all clean, no pig thyroid, it's all super modern and high tech, and this is the state-of-the-art treatment. But it was based on the theoretical concept that everyone was capable of converting T4 into T3 in an effective and consistent way. And so I think it was sort of built on a foundation that doesn't really support some of that premise. But unfortunately, a lot of the drug companies put a lot of money into the med schools. And for decades, it was taught that this was the standard of care. Levothyroxine for hypothyroidism was the standard of care. Of course, you still had some old time doctors back from the 50s and 60s who were still using natural desiccated thyroid. But then in the 80s and 90s, as the internet started to get some traction, patients started to find each other and say, I don't feel well. Do you? And people, no, I don't feel well either. What? And then it started to come out that people began to learn about some of the other alternatives, including this pre-existing drug that had been out there for, at that point, 80, 90 years, and was really helping some people. So the word began to spread, and there was a resurgence in interest in natural desiccated thyroid. And holistic and integrative doctors really started to incorporate it more into their thyroid care as well. At that time, the FDA, however, probably thanks to some help from some of the bigger pharma companies, said, oh, I don't know, we think we may have to look at this drug, take it off the market, make them go through new drug approvals. And because it's been around for a long time and it had never gone through the formal approvals process because it was in existence before the FDA. So it's had some points where we thought it was on rocky footing and might be pulled off the market, but there's enough patients and more every day on the drug that it hasn't been taken off the market. But there are some challenges to getting it. It's under fire by the FDA. So we have Thyroid and WP Thyroid, two brands that were quite good that were taken off the market because they're from a small manufacturer that can't really fight the FDA. And so they've been under siege by the FDA. We have Armor Thyroid and AbbVie, their big, gigantic pharmaceutical company that makes them, is really pushed hard to get the drug designated as a biologic. So it now is going to go through biologics approval. So it's going to be in the same category as these drugs like Humira and Enbrel and, the $5,000 a month rheumatoid arthritis drugs. Our little pig thyroid is going to end up in the same category with these very fancy, very expensive drugs. And I'm afraid that at that point, the price of the drugs could go up significantly. And then, they're not covered by a lot of insurance companies. They're not covered by Medicare in many cases, or VA hospital systems. It's erratic whether you're going to get coverage. And sometimes the prices are higher than you can get a generic levothyroxine for $4 a month. So sometimes these prices are higher. So it's really can be a frustration for patients who want to get on these drugs and who are on them and want to stay consistently on them, to get a steady supply, to be affordable, and to not worry that it's going to get pulled off the market by the FDA at some point if they get in a fit of pique about it. So, Sean, do you have some thoughts about those things as well?
You know, it's fascinating to hear about the history of it, and I love to hear about it. I actually had a question for you, just because talking about pros and cons of NDT. You know, one thing that I've seen over the past 10 to 15 years is recalls, right? Well, you mentioned that the WP and the Nature-Throid have just been taken off the market, and that was a couple years ago. Mm-hmm. And then there's been recalls of the other two, Armor and NP, that I've seen over recent years. I'm curious. I mean, I've read that there was issues that some of the lots were less potent than they claimed to be. So I'm curious, was that true? Is it because they're not as well regulated internally or externally? Why do we see these recalls, and what do we make of that?
Well, I think there's a couple points to make. Number one, apples to apples, there have been like 10 times more recalls of levothyroxine drugs over the last 30 years than there have been of NDT drugs. Okay. In fact, that is why the FDA made the levothyroxine drugs go through the new drug application process at the end of the 1990s. They forced them to go through that. And if they all had to go through this process. And if they couldn't pass it by a certain date, they would be pulled off the market. And a number of them did. So we were left with Synthroid, Levoxyl, Unithroid, and that was prior to Tirosint and Euthyrox coming on the market. But those drugs had a very narrow therapeutic range. But the old standard used to be it could be anywhere from 90 to 110% of potency. So these drugs were all over the place. Now, with the natural desiccated thyroid drugs, there have been recalls. And I've looked at a lot of the recall information. Most of them have been, at least for the RLC products, the WP thyroid and the Nature-Throid, they were subpotent by less than 1%. So it was a very tiny fractional number, and they were getting picked up by the FDA because the FDA was looking at these companies very carefully. They're always at the NDT companies, except for Armor Thyroid. They're at Acela and they're at RLC quite often, testing, doing spot inspections, etc. The NP thyroid was super potent. So they had some people that were getting high doses, and I think we had a couple of atrial fibrillation cases and people that were having overstimulation. So that was obviously a little bit more of a problem for the patients. A subpotent by 1% medication is not going to be noticeable by most patients. But, the FDA has been very, very rigorous about cracking down on these companies, because they are trying to really kind of narrow the market and get rid of most of them, I think, and leave the market fairly clear for this biologic version of natural desiccated thyroid to come into play over the next couple of years.
Very interesting.
Yeah, we actually have a resource on our website about more information about what's going on with the FDA regarding NDT and compounded NDT, which we can send via email, and I have on our website later on after when you guys have the replay. But I just think in medications in general, I'm seeing so many comments here being like, oh, I was on Armor and then I'm on Armor now, but I was on NP thyroid or Nature-Throid before they recalled it, and all these things. And, I just think medication accessibility is always just going to be a struggle. Unfortunately, it's always a shame when we find something that really works well for us. And I have some questions to ask later on at the end of the event, but to kind of circle back, to NDT-based medications. We know that there are different types. We talked about Armor and everything like that being the biggest one, I guess, the most well-known, I guess you can say. Dr. Zager, can you tell us some of the potential side effects patients can experience when transitioning? Because it is different. It's, T3, T4. Are there any side effects that they can transition on, or interactions specifically that may differ, or just interactions in general for people who are just diagnosed maybe and don't even know about interactions that can affect their thyroid medication?
Absolutely. So are you talking about people that would be switching from an existing synthetic thyroid medication to an NDT medication?
Right. Let's say that this is maybe their second or third option. Is there any sort of potential side effects that they can experience from that transition? And then maybe for people who this is their first medication and aren't aware of interactions, what are some interactions that can affect their medication absorption?
Yeah. So I'd just say a few things on that. So first of all, as is the case with any thyroid medication, including NDT, if the dosing is not right, then, if the dosing is too much, let's say, then you could experience symptoms of a medication-induced hyperthyroid state. And I guess similarly, if the medication is too little in dosing, then you could experience symptoms of a hypothyroid state. And that does happen sometimes when we, make that change to the NDT, just because we have these tables and guidelines that help us with the conversion, but they're not perfect, and everybody is different. So it can sometimes be a little bit of the trial and error process. But yeah, so just anytime that the dosing's not right, there can be symptoms on either end, hyper or hypo. I guess, if switching to the NDT medication was the first time a patient was on a medication that included T3, that can, I find that T3 is just a little more potent for people. So sometimes that can be awesome, and people love NDT for that reason, because it just gives a little more pep in their step and they feel more energetic and it just feels right. But for some people, T3 medication is not right. And an NDT has that T3 component. And it just makes people, even if the numbers look good and the dosing is right, just that T3 component can still make people feel a little more edgy, agitated, revved. So just to say that just the T3 component is not right for everybody. And lastly, and this is just an interesting part of this kind of care, is that patients with Hashimoto's, right, which is the autoimmune hypothyroidism, the autoimmune thyroiditis, that many of our patients have. It's not uncommon. Some Hashimoto's patients do fantastic with NDT, and it really, and just like Mary was alluding to, there's probably things about NDT that we don't even fully understand, that the synergy of all the different thyroid hormones beyond just the T3 and the T4 that we talk about, that are the most active or relevant for thyroid care, but that we, to our knowledge, but having the full thyroid gland, as a medication can have its own benefit. And Hashimoto's patients, like non-Hashimoto's hypothyroid patients, can do great with it. But I've also seen cases too, and I'm always on the lookout because I've seen it, that sometimes because it is a pig thyroid gland, it's from another animal, it sometimes can make the autoimmunity of Hashimoto's worse. And so sometimes for that reason, it's not right for Hashimoto's patients. And so, but I don't know a good way of predicting that. So often I'll have to it kind of comes back to that trial and error, but just being sensitive to that as a possibility.
I'll add that I also have coached with some patients that actually had pork allergies. And if you're allergic to pork products, you may find that the NDT you have some reactivity to it. There's also, as Sean said, these drugs are fairly clean, but they do in some cases have some fillers or things that can cause sensitivity in people. So people need to be aware of that. But I agree that the biggest issue seems to be with people that are going from a T4 only treatment to NDT, and they may find that they need to go a little bit slower, or even, and I think, Sean, you're going to talk about this next, but even split their dose during the day so that they can even out that T3 a little bit more, so that they don't feel, because, some people describe it as like they've gone to Starbucks and had 3 triple espressos or something when they take their thyroid medicine in the morning, because they feel really, really amped up. So.
Yeah, can we? I love that transition because I had that experience with myself, and that was something that I didn't even realize was a thing. Was that I was taking this medication, and for the first time, I was like, "Yes, I feel great. I could, rock the world, do all the things." And then by like 2, 3 o'clock in the afternoon, I got that really hard crash. And it wasn't until I started implementing a midday dose that my energy levels were like completely fine, no naps. Can you kind of give us insights, Dr. Zager, into why that's the case, or maybe why some people may need a midday dose and others don't?
Absolutely. It just has to do with the pharmacokinetics of the medications. In particular, the T3 component has a shorter half-life. I want to say that the effects of T3, and Mary, correct me if I'm wrong, peak at around 4 to 6 hours, around 4 hours or so.
Yeah.
And so that's why, in particular, with T3 medications, and this could include NDT because it includes T3, we do this sometimes too, is that we split the dose into people take it in the morning early along with their T4 medication, or just on its own if it's NDT, and then take a second dose early afternoon for that reason. But that said, still, the majority of patients do great taking their thyroid medication, whatever it is, in the morning, and it seems like it lasts through the day for most people. The T4 half-life is longer, and seems to usually get people through the day. It's really a part of the individualization process that we keep talking about. I mean, again, most people do it in the morning. Seems like that gets most people through the day the most effectively, but splitting it up into divided doses, 2 divided doses is also appropriate. And some patients take it at night, and that just works for them better, mostly because they have trouble separating it. You need to separate it by a good amount of time from other medications, supplements, beverages besides water or food. And so for some patients, that's really impossible to do in the morning because they wake up and they need to eat breakfast and go to work. So they take it at night, and that works for them. So there's really not a right or a wrong. These are all good options for people. It just depends on what people need for their lifestyle.
Right. Well, I know that we have a couple of questions, and we're coming down to 15 minutes left of the event. So, Mary, do you have anything to add to that? If not, we can definitely transition to the.
I think we covered it. Yeah.
I think we've covered so many bases. We have a lot of good questions here. So, one question here is: Armor or NP thyroid a better option? Is there one that you recommend more? So, whoever wants to take take the question.
Well, I'll just say, and Mary, if you have a preference between the two, I'd love to hear it too. But I don't have a big preference. I've seen equal amounts of patients do well on either. I don't know. I guess my go-to, if I'm the one kind of directing care, I tend to go to NP, and I like that it is a little cleaner. It doesn't have the corn filler. And so it's maybe just for that reason alone. The pricing sometimes seems to be a little bit less, but it can vary. I've seen, I'm curious, Mary, what your knowledge is on that too. So I don't know. So I guess without a strong feeling about it, I like NP is probably my first favorite. Yeah.
I would say I agree. But I also would say find out what might be covered by your insurance if you have coverage, because sometimes they might cover the Armor, but more often they may cover the NP because the NP is also designated as generic to Armor. So some insurance will cover it at the rates that it covers generic drugs. So it might be worth checking this out before you start down the road on a particular medication, because the difference between a copay for NP and paying full out for Armor can be fairly significant. You can end up with $40, $50 a month bill for an Armor, whereas you might have a $12 copay for NP. So NP tends to be, even retail price, less expensive in general than the Armor. I also think that I like the company's ethics better. I mean, straight out. I just like the way that they approach. They're more informative about the products. They talk about when they change some formulations. They're very transparent about their ingredients. I think I may just be a little bit distrustful of big pharma, which is probably my bias. But I mean, I know Armour is a very safe drug. I have taken it for a number of years along the way. I've taken NP as well. I mean, sad for me, my favorite was WP thyroid, which isn't on the market right now, but we're hoping that at some point it may be able to come back. It's in the works, and it may be back on the market at some point in the next year or two. So, but again, I think the best NDT for you is the one that works best for you, that you can afford and that you can access and get. So, and if one's not available, the other one will probably work fairly well for you. Maybe not as perfectly well as one brand versus another, but they all tend to work fairly well within that category.
So the next question we have, I feel like this is all kind of like a preference, but people are just curious what doctors and advocates are preference. About how long would you say to stick to a synthetic medication before you explore, maybe talk to your doctor about other options?
So really varies. I'm going to say, I mean, some patients within days, within a couple doses, know that it's just not right. I mean, whether it is just feeling fatigued or off or GI side effects. I mean, people sometimes know right away. And then there's certainly other cases that, it strings along for a few weeks, a few months, where you're checking thyroid labs, you're kind of looking at the numbers and just seeing that things aren't really adding up. Symptoms aren't really getting better the way you'd expect. And again, and you can use lab values sometimes too. You can use obviously how patients are feeling, but also the lab values. And once you have a few sets of them, you can see also that it might not be the right medication for them.
Mm-hmm. My philosophy is, when you're working with, in many cases, if you're not working with a Paloma doctor, your doctor's likely going to start you with a T4 levothyroxine drug. And that usually you need to wait about 4 to 6 to 8 weeks to even get your labs rechecked. And at that point, then they're going to look to see, are these numbers improving? Are they getting closer to optimal? Then they may massage the dose a little bit up or down on the just T4 only. So you can go through that cycle several times before you get to a place where you say, all right, I'm stabilized, but my T3 is not really where it's supposed to be. I need something with T3. And many times then the doctor might introduce the synthetic T3, like the Cytomel. And then you go through another couple cycles of this. So many times when I've talked with patients, it's been 6 months, 8 months on a synthetic plan of attack, trying some different things and measuring and remeasuring and changing doses before they say, I'm done. I want to try something different. I want to go to the NDT. But I'd be interested, Sean, I have a question for you. How many patients come to you, whether they're coming through Paloma or walking into your office there in Michigan, and say right from the outset, I don't even talk to me about synthetic. I want to be on the natural stuff.
Oh, you're muted, Sean.
You're muted. Yeah.
Thank you. It happens for sure. I mean, I work with a lot of pretty well-informed patients who have, and as you say, the thyroid community is growing and interconnectedness. People are learning from each other. So sometimes people do come into my virtual doorstep or actual one, wanting that. And I am fine. I like when patients come in having read and being informed, and then it opens up a discussion. And I can say, okay, hey, I'm open to that. I mean, I'm always open to these treatment options. Here's the pros, here's the cons, here's the other options that we might think about. Here's the labs I want to order that'll help guide us. But yeah, sure, let's start with that if that's what patients prefer, and kind of go from there. So it does happen. For sure.
What is your default with your hypothyroid patients? Do you typically start them on synthetic and keep NDT open as an option to resolve continuing problems, or do you have a particular formula you use to decide what to start someone on?
So I don't have a defined protocol there or a default. I really don't. It really depends on so many factors, including what patients have been on before, if they, what their experience has been. I always get that history. and how they've done with those medications that they've been on. The labs help guide me for sure. Just the clinical picture, what the symptomatology is. Again, is there Hashimoto's? Is there not? Like you mentioned, to what degree does person seem to have immune dysfunction or is allergic, have sensitivities to foods and other fillers. So there's so many variables. It's certainly not a default. I just like to, the fun of it is to really talk to people about their options and help them hone in on what is right for them.
Right. Helping them make a decision with you.
Yeah.
For their care.
Yeah.
So speaking of, labs and levels, we have one question here that I think is pretty interesting. So I've been on Armor. I have the best energy, feeling the best. Weight loss is still stagnant, but my TSH seems really low, almost hyper, but I'm feeling the best I have. Any insight?
I can
It's kind
certainly.
of a loaded question without all of
no,
the
it's. I mean, we deal with this a lot. I deal with this,
but
a
curious
lot.
If we see a lot of TSH suppressed on these
Yeah.
sort of NDT medications.
Yeah, so I can, just speak for myself and my own opinion and experience with this, and it does happen a lot. Because there are some providers, thyroid providers out there, whose philosophy is that they'll increase the dosing of thyroid medication, whatever formulation it is, but increase the dosing until a patient says, I feel good. I feel good now, and that's how some providers do it. And obviously we all want our patients to feel well. My philosophy though is I always come back to the first rule of medicine, which is do no harm. And I'm really not a proponent at all of giving too much thyroid medication dosing, causing what this patient is describing as basically a medication-induced hyperthyroid state. Because while some patients might feel well, like they've just had 3 cups of coffee or whatever that feeling of wellness is for them, we know that when that is going on over a long period of time, and granted, younger bodies are able to seem to tolerate it a little bit better, and bodies that are less young, less so, but it can lead to a host of side effects and of harm done, including, palpitations and arrhythmias and leaching of our bone mineral density are some of the classics. But so in that case, I would recommend, reevaluating the dose of that medication if the TSH is low.
Well, and I'll jump in and just add too that one of the things that I know a lot of doctors look at in this situation, not a lot of doctors, but holistic and integrative doctors that work with thyroid too, like Sean, are going to also look at is not just the TSH. They're going to look at that free T4 and that free T3, because TSH is a secondary marker. It's a pituitary hormone, and it doesn't always accurately reflect what's really going on in the bloodstream. So when they're looking at that free T4 and that free T3 and the clinical examination of a patient, if you have low free T4, low free T3, your pulse is not racing, you don't have anxiety, your heart rate is normal, your blood pressure is normal, and you don't have any clinical signs of hyperthyroidism, you're probably not over medicated. Even if your TSH is quite low or suppressed, it means that there's some sort of disconnect in between the TSH level and your actual circulating thyroid hormone levels. So I know that there are doctors that then look a little bit more carefully in that situation before they just knee jerk and say, oh, your TSH is 0.1. I'm going to take your medication dose up. I'm going to take you off of some of your medicines because you're too over medicated. They're going to look at those free T4, the free T3. They're going to look at reverse T3 in some cases and really dive in to figure out. And also, if a patient is not showing any clinical evidence and any T4, T3 level evidence of hyperthyroidism, they're going to make an assumption that the TSH is maybe not as accurate a reporter to base the entire thyroid treatment on. Am I off base on that, Sean?
I just wanted to add that, of course, I totally, it's so important to look at the other markers, the T3s and the T4s, and the TSH is just part of that picture for sure. But just for our Paloma patients, because this also has come up many times now, where people come in with a low T3, a low T4, and a low TSH, like you described. So if for any of our listeners, if this is something that you have seen in your own numbers, that can represent what we call a central hypothyroidism, where it actually is a pituitary disorder, not a thyroid disorder. And to my knowledge, I don't think we treat that at Paloma, that type of thing. So I don't want to get too far off in the weeds, but in that case, it's not a thyroid dysfunction at all. It's a dysfunction in the brain.
Right.
But yes, to get back to the point, very important to look at all the thyroid markers in concert, for sure.
So I think we have one final question here. You had mentioned something earlier about NDT medications could potentially make autoimmunity worse in some cases. Can you kind of explain or give an example of that and what that may look like for some patients?
Yeah, absolutely. So what I meant by that, because autoimmunity, right, is a dysregulation of the immune system, where the immune system is actually attacking your own tissue, and in this case, your own thyroid glands. And for some people, taking a pill that has a thyroid gland from another animal actually confuses the immune system further and causes the immune system to go a little more haywire and become more dysregulated, which in the case of Hashimoto's causes a further attack on the thyroid gland. And we measure this with antibodies like the TPO antibodies or antithyroglobulin antibodies. And so we can see it in the numbers too. And when that happens, it essentially decreases thyroid function from an already hypothyroid state most often. So the symptoms people would experience is actually usually worsening hypothyroid symptoms in that sense.
So they'll see elevated TSH markers in addition to potentially TPO antibodies
elevating as well. Yep, that certainly can be seen in that case. Yeah.
Great. Well, I think that's all the questions that we have. Mary, Sean, do you guys have any last comments that you would like to add for all of our listeners and for the people that will be watching our replay here? And again, thanks so much for all of your guys' insight.
Well, I just want to tell people, that Sean is just such an excellent example of the kind of incredible care you can get from Paloma doctors. And I know 25 years ago, when I was first diagnosed with a thyroid problem, I would have given anything to have a doctor who could talk to me like this and explain things, and who understood and who respected the fact that I had options and wanted to work with me to find the right option. So I just want to say 3 cheers for Sean and 3 cheers for Paloma for being able to, give Sean a platform tonight to tell us more about some of his approaches and his thoughts. So, and it's been just a blast talking about this because, I've been on natural thyroid for years, and like I said, I think whatever works best for you is what works best for you, but that's what works best for me. And so I am always happy to make sure people know it's an option. And I'm always out here advocating to try to keep it available as an option. So.
That's great. Thank you, Mary, for saying that. And thank you for all your advocacy. I know you've helped so many patients through the years and continue to do so. It's really fun being on, this panel with you, Mary, and Alex. Thanks for moderating and all that you're doing. And really, honestly, it's a pleasure for us all to have this platform with Paloma. It's an incredible niche that I think is just going to continue to bring value to thyroid care in this country. And so it's fantastic to be a part of it, and helping patients know their options so they can feel well,
Yes.
So.
Yeah, I can definitely say when I found Paloma about 3 years ago, I was like, where were you 8 years ago when I was first diagnosed? So I can't imagine the women, unfortunately, who were diagnosed 20, 30 years ago are just so grateful, So spreading the word, I think, is our biggest thing, and realizing that, thyroid care doesn't have to be hard or a struggle, and that you can find people and providers and community who understand what you're going through and will actually work with you and not just, tell you what to do and you have no say in your care. So, I love all those aspects. So yeah, thanks again, Mary Sherman. Sean, Zager, you guys are so awesome. Thank you so much for joining us for our live event. For all of our, attendees, replay listeners and viewers out there, we are Paloma Health. We're an online medical practice that focuses on hypothyroidism. This discussion here just talked about the pros and cons of NDT-based medication, which is, a type of thyroid medication hormone therapy that you can explore with your provider. And this this event will be available via replay. So we'll go ahead, and all of the people that registered, you will get a link to go ahead and view that replay. And, we can continue the discussion on our community page. For anyone that has any questions and everything like that, we're more than happy to answer. And all resources that we have as far as, we discussed in this event that what's going on with NDT-based medications and the FDA and all of the changes. We actually have a blog post about that that's currently live on our website that you could go check out there. We also have a bunch of different guides and everything talking about your medications, how to take them and everything. So go ahead and peep our Learn Center. You could go ahead on the app as well. We have all of those resources and everything available. And yeah, thank you so much for attending. And again, you too, thanks so much for taking the time out of your evening to join us and just have this great conversation to just continue informing our community of what's possible and, the best options for them and their care. So yeah, without further ado, I guess we'll just go ahead and wrap up. And
Thanks
thanks
Alex.
everyone for